Western Connecticut Health Network is 3 hospitals in 3 different locations across a region in Western Connecticut. And regardless of their ability to pay, we are here to provide services to all the community members who require them.
The Western Connecticut Health Network is primarily responsible, as far as we're concerned, to promote and protect the health of all the people that we serve in these communities. That's mission one and really the only thing we have to do.
The executives of Western Connecticut Health Network reached out to our consulting group because they had some really broad, far-reaching cost reduction goals to achieve, and they were looking to achieve them across a really wide continuum.
One of the things I really wanted was a partner in achieving those cost savings and helping me find those opportunities and staying with us to achieve those opportunities.
Western Connecticut Health Network has an incredible culture that's founded on accountability, from the senior leadership team down through middle management, as well as their physician leaders. Accountability is just the way that they operate within their organization. They challenged our team to really thoughtfully consider how you would value some of those non-supply, non-traditional opportunities in a way that at the end of the day, it would hit the bottom line of their financials.
The way we were able to find cost reduction opportunities in the clinical areas were really through the subject matter experts in contracting with orthopedic supplies or productivity or stents in the cath lab and the interventional radiology departments. Those subject matter experts knew those departments. They've had experience working in those departments across the country.
I was very impressed with the subject matter experts. First of all, surgeons speak a different language. We speak in terminology, and these subject matter experts, although not surgeons, knew exactly what we were saying.
From their experience, it was able to help us think through rigorously and provide us with very granular benchmark data that helped the doctors recognize that there are ways that they could do things differently. So that was true for utilization of things, it was true for purchasing, it was true for how we manage length of stay and workflow. When you go back to the notion of lean methodology.
There were significant pieces around putting some clinical criteria in place for when it was appropriate to use a particular product. You take that a step further and then begin looking at patient throughput across the care continuum. There was some pretty significant variation in length of stay by particular physicians. So reducing that variation was pretty critical and successful.
The way we were able to address clinical variation and utilization among all the physicians across the network was, again, through subject matter experts. And one of the examples in the clinical arena we had was around the spine surgeons using bone morphogenic protein across the network.
With BMP, the data that we got and realizing that we were at over 50th percentile of national utilization was sort of a surprise for us. I don't think we thought we used it that much. So we decided as a group that we were going to reduce the utilization.
They were astounded at the variation that they had among the 6 doctors who all work very closely as the spine surgeons in this organization. And to their credit, they took that information and they built new protocols. We've seen much less variation and more appropriate utilization of bone morphogenic protein across the network. So once we achieve cost savings, our goal and most difficult part is to sustain those cost savings. And what we've established are clinical quality value analysis teams where we have significant infrastructure put together for providing CQVA teams for each of the critical areas. Other things we've done is we looked at the benchmarking tools and have subscribed to a number of those benchmarking tools so that we can keep an eye on what's happening out there in the marketplace. We achieved the $6 million goal, but really the important piece to remember here is many of the things that we didn't only occur in 1 year. They're multi-year contracts, so we're looking at cost savings of over $16 million across 4 to 5 years. The reason why I was so passionate around this initiative is because there are opportunities out there we can reduce that waste that doesn't impact patient care negatively. It can enhance patient care. It could provide more funding to put more money into patient care initiatives.